There will be at least 60 to 70 providers. With our people together, we probably have 75 to 85 total people. And we hear their frustration day to day, and then knowing that we are able to support them best. And then I want to also know and hear directly from you what you just did today is amazing, and spending the time with us. So I have one little side question. So not because I promised that I was going to behave. So now you worked with Donald Trump directly.
I did.
Now I wanted to actually tell you this. So I have two sisters, one older, one younger. My older sister is amazing in terms of how she takes care of everything for us, the entire family. And now she works with me in the Turkey office. My younger sister, she's higher up in the government in Turkey, and one of her role is working with the Minister of Family and Social Services, and she's in charge of the women's status in that ministry. And I see challenges women have every day, and still the equity, equality, this all comes up all together. Now, you, with your background working with Trump, how was that? I'm not looking for any juicy details, but you did a great job, I know, and he picked you. How was that working relationship with him?
Yeah, you know what? I think people are probably surprised to hear me say this because I think there's a lot of rhetoric out there when it comes to the president. But I started working with the Trump organization during his first campaign. Mm-hmm. So a very long time, and I was with him through the last day of his first term, so all the way through. And the reason why I lasted so long was because he was good to me on a personal level. He always had my back, always protected me, and it's a tough environment, but I always felt like he had my back. The other thing I would say is that he really valued my opinion, and he gave me a lot of latitude to do whatever. So there was a lot of trust between us where I think he said, look, go fix healthcare. I felt like I had a good understanding of what his goals were, what his accomplishments were. People thought that he was against Medicaid, that he was against helping people get health insurance. And I had some very direct one-on-one conversations, and he really felt strongly about people having access to health care, really wanted to see things improved. And he opposed the Affordable Care Act because he felt like it was actually increasing costs for people and actually creating problems for different types of people. And so we really connected on that because I think we shared that same value about trying to improve the system and wanting to make sure that every person had access to high quality health care. So I enjoyed my time there. It's certainly one of the most difficult jobs I have. My current job's hard too, but that was hard in a different level. But what kept me there over the 4 years was the relationship that I had for him. So he valued my opinion. I think there was a lot of trust in our relationship and he was a great boss. I think there was one time, I heard Sarah Huckabee Sanders talk about him at the convention, and she talked about, I think, a way that we don't really see that President Trump. He was just, sometimes I would call it almost fatherly. He could be very tender and supportive. When we see him on TV, we don't necessarily see that side of him, but always very positive, very encouraging. He'd give me a call and he's like, hi, I saw my Seema on TV today. So it was a pleasure to work with him and an experience of a lifetime, and something I'm very grateful. I'm grateful to him for that opportunity.
Excellent. I'm glad to hear all this, and I guess that was the case because you stayed there for the entire time, and if it was not the case, then you wouldn't stay for that. And we want to see more women in these positions, qualified people. But when they are doing their jobs, they shouldn't have any difficulties. And because of my sisters, I'm always on their side. And seeing someone like you succeeding and doing what you are doing even today, you are building much more to what you did at CMS. This is amazing. And having you also here for almost 45 minutes is also amazing. And I know this is going to be helpful for many of our providers and in some cases for our employees and our patients too.
Well, it's a pleasure to be here. You guys are doing exciting things, and we appreciate that you work with us and the development of these products. We have a great technologist, but we need those providers on the front lines that tell us what to build and what's going to work and what isn't going to work. So we appreciate the partnership.
Well, thank you so much. And thank you for everyone watching us. Stay united. Bye-bye.
Thank you very much. We appreciate it. Good to see you again.
Good to see you. location there, so you can let me know when it's time.